Hi, everyone. My name is Leslie, and I'm excited to be able to brief you all on the information we've gleaned from our research about launching a contactless campus-based food pantry serving graduate students during the COVID-19 pandemic. My fellow authors include student Sarah Maudlin and principal investigator Dr. Katie DeSantis, all from Thomas Jefferson University's College of Population Health. To begin, we wanted to highlight the prevalence of food insecurity among graduate students. We see rates double that of the general population, sitting between 35 and 42%. These figures have just been exacerbated due to the economic crises associated with the pandemic, showing that 3 in 10 college students report having skipped a meal at least once per week since the beginning of the pandemic. The effects of food insecurity reach into all realms of well-being, including mental and physical health, as well as academic success. Identifying interventional methods to reduce food insecurity in students is necessary in order to overcome these negative health outcomes associated, as well as improve academic performance. Although there's not a clear number on the amount of campus-based food pantries in the US and even less data on campus-based food pantries aimed at providing healthful options for their users, we look to design a marketplace that could operate in the COVID-19 pandemic and provide healthful food options for students. Our logic model describes our transition from development in the early days of a website and operation manual, as well as creating standardized procedures, onto the coordination of the funding and donations to get us up and running. Finally, leading into the data assessment of the student users, our pantry outputs, and the ongoing assessments. All of these were aimed at increasing healthy food access and awareness of social support services eligibility in our students. We utilized a Qualtrics survey tool to allow students to order ahead and allow for contactless pickup in order to align with social distancing requirements, and it allowed us to better analyze and track our data. The food offerings at the pantry were healthful, falling within the USDA's My Plate guidelines with an emphasis on whole grains, fruits and vegetables, and proteins. We did also account for dietary restrictions, including vegetarian, vegan, and gluten-free options. Now, into better understanding our student users, we highlighted some factors that influence food insecurity in students, from lack of access to financial aid that meets basic needs, as well as lack of access to healthy, affordable foods in their area, to negative subjective norms and negative personal attitudes and beliefs towards food pantry use, to a general lack of awareness of resources available and lack of institutional level support. Our outputs of our pantry identified a 60% completion rate with 88 completed order pickups of the 147 orders placed. We also break down by food group what was distributed by the food pantry, showing over 2,900 servings of whole grains, almost 300 servings of fruits and vegetables, 243 servings of proteins, and for our non-food items, we distributed 100 units of feminine hygiene products. Within those food groups, we also identified the healthful food item that was most requested, showing quinoa and whole grain pasta under whole grains, frozen fruit and vegetable options, as well as fruit and nut bars for the fruits and vegetables, and canned tuna and almonds for protein. Our student demographic breakdown includes full-time students, nearly 2/3 of which hail from the College of Nursing, College of Pharmacy, and the Sidney Kimmel Medical College. Additionally, we investigated the student motivation for use and showed that nearly 80% of the market users had allowed them to save money to use for other necessary items, as well as nearly 70% reporting that the market allowed them food items for meals they would have otherwise needed to skip. These results show three main takeaways in that anonymous online orders allow for Contactless pickup, which in the realm of COVID-19 is important, but also anonymity to combat negative stigma to use, as well as an enhanced ability to order by food group to walk away with a complete balanced meal option. Our directions for future research include engaging users more deeply about their food insecurity status, diet, and budgeting. However, we're also looking to expand not only to the users of the pantry, but non-users to better engage and serve the community. Thank you.